real life family, it's Dr. Ayisha here, and I am, after a long day of work, I said enough is enough and I need to do this video because I need to do some education. And I'm here to talk about high blood pressure, also known as hypertension. And what does that mean? Because a lot of us aren't getting checked for it, or we're in denial, or we're not taking our medication, or we think because we are taking the blood pressure medication that we no longer have a diagnosis of hypertension. Well, once you're taking medication to lower your blood pressure, then guess what? You have a diagnosis of hypertension and it isn't going anywhere. You just are on medication to maintain an adequate blood pressure. So what is hypertension? Hypertension basically is the force that's created, or the pressure that's created in the blood vessels when the heart pumps and pushes the blood out of the heart into the blood vessels. That's what it is. Well, as we age and with other risk factors, and those risk factors include or can include genetics, poor diet, lack of exercise, smoking, high cholesterol, diabetes, these arteries or blood vessels can lose their elasticity, and it makes them stiffer and less compliant as the blood is being pushed through them. What also occurs is there's damage to the inner lining of these blood vessels, and where that damage occurs, plaques can form. Well, what does that mean? What's the significance of a plaque? Well, these plaques can get larger and larger and larger, and to a point where then they block off the blood that's flowing through that blood vessel. Well, what's the significance of that? Well, if that's the blood vessel that's supplying blood to your heart, then guess what? You're having a heart attack. Or if that's the blood that's supplying, if that's the blood vessel that's supplying blood to your brain, then guess what? You're having a stroke. And let me bring it really home. If that's the blood vessel that's supplying blood to your genitalia, then guess what? You're going to have lack of sensation and possible sexual dysfunction. So we need to take our blood pressure seriously, and we need to know the numbers. Stop just going with the medical assistant or the triage nurse, the doctor or the nurse practitioner saying, oh, your blood pressure is good. Know the number, write the number down, text it to yourself, put it in your phone. We put everything else in our phone, so why can't we do that? So let's do some education. And this is what the numbers mean and what's a good number and bad number. So the top number is the systolic, and that is 120, or excuse me, less than 120. Less than 120 is the systolic, the top number. And systolic is basically the force that is created as the heart pumps and pushes the blood out. That's what systolic means. The bottom number is less than 80, and that is the diastolic. And the diastolic means when the heart relaxes after it has pushed the blood out. So less than 120 over less than 80 means you do not have high blood pressure. Okay, so what if I'm 120 to 129 on the top number, or over 80? Well, guess what? You have pre-hypertension. Okay, let's take it another step further. What if I'm 130 to 139 on the top number, and or greater than 80 on the bottom number? Well, you have a diagnosis of hypertension. So anything greater than 130 on the top number and or greater than 80 on the bottom number, you have high blood pressure and it's not up for discussion. So what do we do about that? What can be done? Well, number one is know your numbers. Number two is let's go back and try to change some of those risk factors. Well, age, I can't do much about. Genetics, you're born into the family that you're born into. Can't change that. But we can incorporate exercise. We can stop smoking. We also can incorporate a healthier diet. We also can any other chronic medical conditions like diabetes or any other high cholesterol or cardiovascular risk factors, we can also try our best to take the medications for those chronic medical conditions to improve and decrease our risk factors for developing high blood pressure. So, next time that you're at the doctor, what are you going to do? You're going to, number one, ask for your numbers. Number two, you're going to write the numbers down. And number three, you're going to stop taking blood pressure, hypertension as a joke. Because guess what? It is known as the silent killer. And the reason why it's known as a silent killer is because by the time you feel a symptom, yeah. And some of those symptoms might be chest pain, shortness of breath, blurred vision, headache, kidney issues, heart attacks, strokes. And let's bring it back home one more time, sexual dysfunction. So by the time you feel any of those symptoms, that means that your blood pressure has been ridiculously high for a long time. So advocate for yourself, know your numbers, stop sleeping on hypertension.